Hi, my name is Dr. Denise Wong, and I'm here to talk about something called the medial epicanthoplasty. Some patients have a stronger medial epicanthal fold. And what that is a kind of a crescent, semilunar shaped skin that hovers over the inner corner. This is a very common trait, especially in Asians. And sometimes having that fold can make your eye appear smaller and shorter. So doing a medial epicanthoplasty can help elongate the eye as well as open up the eye in a horizontal dimension. Some patients want a specific type of eyelid crease, and there's different shapes of the eyelid that you can achieve with the upper eyelid surgery. One of them is called a parallel line, which is basically when the eyelid and the eyelid crease as well as the lash line is basically an even amount of distance all the way across the entire eyelid. And in order to achieve that, sometimes we will need to adjust the inner corner of the eye to open up the inner corner so that you can actually see the entire eyelid crease. Some patients prefer to have a more open appearance in the inner corner, so a medial epicanthoplasty can achieve that. It does involve excising some skin and rearranging some of the tissue in order to create a more open appearance.